joining us today. We are here to talk about overdose deaths in 2018. After 7 years, consecutive years of increases in overdose deaths, we in New York City have seen a decrease in the number and the rate of overdose deaths in New York City in 2018. While this is positive news that we are bending the curve, it is not a moment of celebration and there is more work to be done. In 2018, there were 1,444 overdose deaths in our city, 38 fewer than in 2017. This was made possible through over $60 million investment through Healing NYC and a public health approach that emphasizes harm reduction and increasing opportunities for individuals to access addiction treatment services without stigma. The numbers we see are a cause of cautious optimism that our robust public health approaches, bolstered by historic investments in treatment, are showing returns. Through partnerships with community-based organizations, faith-based institutions, and the healthcare delivery system, we have distributed over 230,000 kits of naloxone throughout the city. We have expanded access to effective treatment by training 1,800 new prescribers of buprenorphine and expanded funding, doubled the funding for services at 14 syringe service programs. We must recognize the thousands of people who have stepped up and saved the lives of our fellow New Yorkers. Our trainers are an overdose using naloxone in practically every community. There are trainings in bodegas, barbershops, libraries, senior centers, bars, and nightclubs. It's free and we're available to train anyone, anywhere. We're also making it easier to prescribe buprenorphine, a medication to treat addiction, at health clinics, syringe service programs, and hospital emergency departments. Many hospital emergency departments have implemented overdose prevention strategies when working with overdose survivors, including starting buprenorphine and giving them naloxone before they leave the hospital in order to prevent future fatal overdoses. And as practitioners and policymakers, we have adapted. We meet people where they are. We recognize that there are many routes into addiction and many routes out of addiction, and we want to help people find what works for them. But the sad reality is that too many of our fellow New Yorkers have died from overdose, and too many continue to lose their lives every day. While 38 fewer people died in 2018, these decreases were not felt evenly throughout the city. The number of overdose deaths fell among Brooklyn and Queens residents, but rose among residents of the Bronx, Manhattan, and Staten Island. White and black New Yorkers experienced fewer overdose deaths, but we saw an uptick among Latinos. And residents of neighborhoods with the highest rates of overdose death, namely East Harlem in Manhattan, Crotona and Tremont, and Hunts Point, Mott Haven in the South Bronx, had overdose rates that were more than twice the citywide average. As the city's doctor, I am concerned that New Yorkers are still unaware of the dangers fentanyl poses in the drug supply. Fentanyl is in heroin, fentanyl is in the cocaine supply, and it's also being detected in some counterfeit Xanax pills, as well as in methamphetamine and ketamine. Fentanyl is a killer amongst New Yorkers, and we urge anyone who uses drugs, please don't use them by yourself. If you overdose, someone else will need to call 911. This information can save lives. We will be holding a naloxone demonstration at the back of the room once this Q&A is over, and it'll be done by our staff member, Molly LeBou. efforts I have spoken about today reflect just a few of the examples of what we're doing, and I want to emphasize that we all have a role to play in continuing to reverse the tide of these deaths because they are preventable. I am hopeful that these findings mark an inflection point to our ultimate goal and serve as a reminder that our collective efforts must continue until the gains are equitably distributed across the city. So I will stop here and I will take questions now. Yes?
You mentioned that there are more Latinx New Yorkers who are dying from overdose. Do we know anything more about these deaths, like who's getting help and who isn't?
So at this point, we have seen a 5% increase in 2018 as compared to 2017. There isn't very much that we are able to say other than the fact that it looks like the deaths that are attributable to Latinos have an increased percentage that are associated with fentanyl.
And is there anything that the health department plans to do towards targeting that population specifically?
So as part of our Healing NYC efforts, all of our material has been translated into multiple languages, including Spanish. We have done targeted outreach to ensure that we are maximizing the number of individuals that are trained in administering naloxone. Additionally, through our efforts in increasing the number of medical health care professionals that are trained to prescribe buprenorphine, we have been focused on targeting particular parts of the city with not only high Latino population, but are at risk for potentially fatal overdoses. And then lastly, I'll say that our efforts through the Bronx Action Plan that went into effect in late 2018 are additional ways in which we anticipate that not only will we be able to continue to bend the curve both in terms of the geography that's affected, but also in terms of the black and brown population in New York City.
It's a 5% increase from 2017 to 2018 in deaths among Latino people.
Yes.
Can you say anything more about, are there any challenges unique to the parts that saw an increase in deaths, you mentioned South Bronx, East Harlem, challenges that are there that are not in the parts of the city that saw a decrease?
I think the way that this opioid epidemic has played out really reminds us that these deaths are a culmination of years worth of disinvestment and racist deployment of drug laws, and it will take years to really come out of it. The other thing that I would say is that these overdose deaths are really complicated by not only the disinvestment that I talked about, but issues like poverty and trauma that we see in these communities. And that's why, the approach that we have taken in New York City, which is really leading with a public health approach, I think has made a difference in seeing inroads in all populations. What we're interested in is seeing that as we continue to bend the curve, that we will see it more equitably across all of our communities.
What was the specific decrease for Black and Brown community?
So the numbers that we have seen in those reductions have varied. What we have seen for individuals, for Black individuals, I'm going to turn over to my team here. We have seen a 5% decrease for the number of white New Yorkers, and for Black New Yorkers by 13%. Thank you. Other questions? Yes.
Do you know how many doses of Narcan were administered in 2018, and if so, how were they paid for? Are they free or taxpayers?
So the emphasis on naloxone has been to saturate parts of the city where we have seen large numbers of overdose deaths primarily, though they can be anywhere in the city. There have been efforts to ensure that we have increased naloxone access. So through our pharmacy initiatives, New Yorkers can go and get naloxone so that they have it with them. One of the strategic decisions that we made early on is to not, quote unquote, require individuals to tell us when naloxone was actually administered. We want to be focused on making this as stigma-free as possible and ensuring that there are no concerns about what this then can mean for individuals who have administered it. So we are focused on destigmatizing the use of naloxone, and we have launched several campaigns, including the one that I Saved a Life, where we really highlight everyday New Yorkers using naloxone and really making the point that an overdose death can occur anywhere in the city, and we need all New Yorkers to really be aware of the dangers of fentanyl, to be aware of the life-saving naloxone medication, to know that they can call 311 for the pharmacy nearest them where they can get naloxone, and to call us through 311 or visit our website to learn about the next training that's near them. Yes.
I recall that, I think on Staten Island some time ago, there was an emphasis targeting drug dealers, prosecuting for their deaths. Would you be willing to say that law enforcement is really
So this bending of the curve, I think, illustrates the efforts that we have all made in leading with a public health approach. So it's not just about what public health does, it's not just about what the healthcare delivery system does, but it's what we do in collaboration with faith-based institutions, with community-based organizations, with law enforcement, so that we can all take a more intensive public health approach to really bending the curve. I think we're all in agreement that this is not something that we're going to be able to arrest our way out of, and it's about saving lives. Yes.
Page 4 of the Epidata sheet, I see that state that's in St. George, which is in Staten Island, dropped off like the top 5 list in 2018. And I'm curious if you would contribute that to the investment that's been made in Staten Island in previous years for dealing with the overdose crisis, or something that's not working in the Bronx. That is, like why Staten Island seems to be improving, but the Bronx is not.
So before I do that, I want to just correct a statement that I made because I think I reversed my statement. For between 2017 and 2018, the percentage for whites decreased by 5%, and the percentage for blacks decreased by 13%. In terms of the numbers fluctuating from year to year, we will invariably see these types of fluctuations from year to year. I think the important thing to look at is what the trend is and how it is that we continue to emphasize, and tightly knit all of the initiatives that they're underway. There isn't really, we've demonstrated that there isn't one particular way to get yourself out of this. It's not just about naloxone. It's about weaving together and layering all of the activities that are in place. So to a certain extent, it's not surprising that we see small fluctuations from year to year. The important thing here to note is that we as a city and as a health department continue our commitment to ensure that bending the curve is realized in a way that's equitable for all communities that are most affected.
Let me rephrase the question then, because what I'm seeing, and please correct me if this is the wrong interpretation, that it's this plan seems to be looking at the white people and then the people of color. And I know you mentioned 13% cases like dying from overdose deaths, but what is the city doing to really make it more equitable? And like, why is it working in Staten Island? We've got an investment in the overdose crisis before the Bronx, but even though the Bronx has for decades had its
So I'll start, and then I'll draw on my colleagues for the specifics around the fluctuation in Stapleton. The efforts that the city has put forward are really driven by the epidemiology, right, and by what the numbers show us. And so there has been a concerted effort to work with communities that have been most affected, both including Staten Island as well as the Bronx. The Bronx Action Plan has brought together the alignment of investments under Healing NYC in a way that is looking to maximize the degree to which we're saturating the South Bronx with naloxone. Currently, in partnership with health and hospitals, all of the emergency departments that serve residents of the South Bronx are having programs in place that utilize peer workers and advocates to ensure that we are meeting people where they are, that when an individual has a potentially life-threatening event, such as an overdose, we are there to link them to services and help them start the path to recovery. So all of these efforts are targeted at communities that are really suffering disproportionately, and that we want to see, again, better health outcomes faster. So I'm going to, okay, good, thank you. Anyone else?
Looking ahead, is the administration going to have any new policies or proposals to deal with overdoses?
So I think right now, as I mentioned earlier, the Bronx plan, those efforts are not reflected in the 2018 numbers. So we are going to be anxiously awaiting the 2019 numbers so that we can fully realize the momentum that those activities have shown us. You know, what I would add is that in truly bending this curve, not only for New York City, but for the country as a whole, I think we need to look at federal policy opportunities to eliminate the waiver requirements for prescribing buprenorphine. It shouldn't be easier for a doctor to prescribe an opioid than it is to prescribe a medication to treat an addiction problem. The other thing I would note is that I think we should be looking at having naloxone be an over-the-counter medication, and that again is something that the federal government could act on.